to, thank you. Just before we start, oh, I don't want, my thing doesn't want to move on. Just 1 second. Bear with me, people. So just a little brief intro about the Paediatric Society. We say this each time, but we'd love more people to come along and join us. So the Paediatric Society is like a group of health professionals from all over Aotearoa, New Zealand, and our priority is progressing the health and well-being of children in Tamariki and young people in rangatahi. There are so many different professions in the group that there's amazing special interest groups and discussion boards. They also have conferences, and they support the New Zealand Child and Youth Clinical Network, which is where the Lunch and Learn sits within this group. And our goal is to assist in the delivery of equitable specialist care to all children. And we also offer a grant to members by application. So if you want to write that down or click on that website, we'd love people to come along and join us. Today, we are really lucky to have Simon Leadley come and present to us on his research. Simon will speak more about the research, but I just want to introduce Simon to you. So he's a lecturer at the Occupational Therapy Department in Monash University in Australia. So Simon's making himself available to us. I think it's still quite early in the morning for you there, maybe, yeah, quite early in the morning. So thank you for joining us. And I'll leave it for Simon to present on his research. And then at the end, he's going to pose some questions to us, which we hope that you will join back in the following month. Simon's going to come and join us again for us to have like a knowledge translation session discussion where we all get to talk about Simon's research and how we might use that to advance care for the children that we work with. So I'll just stop my share now.
Kia ora, Jane. Thank you very much for that introduction. And it's my pleasure to be here. It's not too early here. It's only about just after 10 a.m. So are you able to see my PowerPoint?
Not just yet.
Not yet. Oh, hang on. I know why. It'll help if I share my screen.
Yeah, perfect.
There we go. That's a bit better.
Simon, I think, yeah, that's better. You were on notes pages. That looks great.
Takes a couple of clicks. There we are. So kia ora koutou. The presentation today is looking at the ways that poverty shapes Tamariki children's patterns of participation in their occupations and their potential well-being for your Lunch and Learn series today. Just by way of introduction, I just want to start with my mihi. Tēnā koutou, he mihi kei te whare e tēnei, te pāpa e te kātou nei, me te kōpapa o te rā, e tipu ake ahau ki Waikato, no Ingarani, no Airangi o ka tupuna, ko Simon ahau, ko Frankston, Victoria, Australia, toku kāinga in Aianei. He kai whakaora ngāngahau ahau, nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. So just introducing and saying thank you very much for inviting me here today. My ancestors are from England and Ireland, and I'm originally from Waikato in Aotearoa, and I'm an occupational therapist, currently based in Australia. Also, because I'm in Australia, I wanted to do a quick acknowledgement of country. In acknowledging country, I pay my respects to the Bunurong people on whose lands I'm currently on, and wish to acknowledge them as traditional owners. I'd also like to pay my respects to their elders, past and present, and Aboriginal elders of other communities. Sovereignty has never been ceded, it always was and always will be Aboriginal land. I also wish to pay my acknowledgements to the fact that my study is under examination at the moment. As Dr. Jones will know, it's almost there. I want to pay respects and gratitude to Professor Claire Hocking and Dr. Margaret Jones for being my supervisors throughout my PhD journey, and to Ms. Bryant and Mr. Tokalahi as cultural advisors, and to the Occupational Therapy Association New Zealand and DV Bryant Trust for their financial contributions. Just briefly to outline the presentation today, I'm trying to keep this to 25 minutes. So quickly look at definitions of child poverty and the impacts or effects for Tamariki of poverty. What we don't really know very well about the topic, the aims and the research design briefly behind the study, the outcomes from the study, and some brief proposed solutions. Poverty and child poverty can be defined in a number of ways. Typically, people will think to the lack of income or lack of resources. However, there are other approaches to understanding how poverty can be conceptualized or understood. We can think of the rights of children and whether those rights are being honored and met or not as one way. Also, there's increasing focus on the strengths-based approach, what children and their families are able to do and achieve in their life, as well as acknowledging the difficulties they face. So bringing lots of those perspectives together as a multi-dimensional perspective to poverty, and that's much more contemporary in today's research space. In this study, I used a qualitative research design and a multi-dimensional income approach, a poverty approach. So looking at income, area levels of deprivation, the decile that school of the children were attending, and the perspectives of the children and their whānau family. So what do we know about in the current literature that informs us about poverty's impact on Tamariki and children? There's an abundance and a wealth of knowledge about how poverty harms children's development, their health, and their future outcomes. We know that the literature informs us that poverty restricts and constrains children's participation in occupations like joining sports clubs or affecting their other recreations or their schooling or education. We also know from the literature that children face worse outcomes than their wealthier peers, for example, affecting their school and their ability to succeed, their health outcomes, increased rates of obesity, etc. We also know that children experience stigma, shame and whakamā, and exclusion in their early lives. However, despite these difficulties, a lot of literature is pointing to the resilience and the way that young people are able to cope with their situations through adaptation, through learning strategies, through finding creative ways to cope, supporting their parents and their siblings and others, and the love and care of parents and community. What we don't understand so well on the topic is how poverty influences children's patterns of occupation. So their habits, their routines, their roles, and the family activities and rituals in their life. There isn't very much information on this topic. And also, there's not much information on how poverty affects children's participations across a broad range of childhood occupations, not just targeting one area like sports or education, but looking at their daily activities, looking at all those collections of meaningful recreational cultural activities and whether they are able to participate fully. We don't know what that means for their connection to their future potential for their well-being and hauora. There's also very little information, particularly in New Zealand, around how poverty interacts with either the parents or a child with a disability in the home. We do know that in New Zealand literature, there is a high likelihood of being in poverty if a child or a family member has a disability. There is, I must add, quite a bit of information coming out of the Children's Commissioner's Office when it was working on this topic, and also the New Zealand Child and Youth Epidemiology Service, excuse me, big word. So just to look at the study itself, this is the question that was posed. How does poverty shape Tamariki's patterns of participation, occupations, their potential and well-being? So for this purpose, I systematically reviewed the literature on the topic. I conducted a study in the Aotearoa New Zealand context and aimed to gain the views of the Tamariki, their whānau, and the community. And this alongside my interpretations, the input of my supervisors, and the evidence and literature and theory on the topic. I was aiming to better understand the issue and answer the question, and to come up with some practical, pragmatic, broad brush solutions. So briefly looking at the research design now. This study was a qualitative case study methodology research approach based on Stake's version of it. There were two neighbourhoods in the city where the study was conducted, two cases, I should say, and they were both around two neighbourhoods of high socioeconomic deprivation. The participants were drawn from these neighbourhoods, and there were two, I gave the two neighbourhoods fictitious names, Fernley and Riverfield, to help protect the participants' identity. The Tamariki, or children, were between the age range of 10 to 13 years and included their parents or their whānau, other adults who supported them, and community organisations who work to support whānau in these neighbourhoods. We did have one exclusion, and that was that there was no significant disability for the child, so as not to confound the aim to understand the influence of poverty on participation. We used a range of methods. Initially, there was two focus groups with 5 and 4 children each. Used semi-structured interviews with the children and their parents and adults. The children completed a weekly diary about their daily activities and occupations. And they also completed a photo elicitation method where they took photos of interesting occupations to them and then talked about that and explained the meaning of that to them. For example, going to school or the Christmas events with the family at home. We also completed a novel mapping activity where children and often their parents are involved in mapping out where they went to in their neighbourhood, what occupations they did and where, how they got there and how often. I sought cultural consultation from Māori and Pacifica colleagues, as I've mentioned, and ethics approval was provided by AUT, and the data was gathered in 2022. This briefly just shows a little bit about the participants in both case studies, Fernley and Riverfield. As you can see, there was a number of participants, both in the community centre level, such as Nikau, the centre manager, or Trevor, who was a manager in Fernley, or Georgia in the after-school program, Molly, who was a school principal. And then the 4 children after the focus group was Miriama and her whānau, Jared and his whānau, Offa and his whānau, and Matio and the whānau. So those 4 children were drawn from the original focus group. I just wanted to start the findings section by introducing you to the voices of the children of the Tamariki and to hear about the occupations they loved doing and what supported them. I'm just not sure if that's hiding that there. I'll just move it across. So what the children were saying to us was what's important, what they like doing, time with my friends at school, playing, te reo, learning, hang out with my friends, uratatanga, values and life skills, karakia, kapahaka, or Friday nights at the mall. And the things that supported their doing and well-being included their family, my family caring about me, friends making me laugh, church, music, confidence in myself, my family and friends, encouragement. Oop, there we go. And secondly, I wanted to show you just a few examples of the photos that some of the children took, and just to explain, I guess, highlight the importance of these occupations for them. As you can see, some examples, but highlighting the importance of culture, of their family and whānau. So meals and special times were precious to the young people. Time in the backyard with family or friends, that was important, sharing a barbecue, Christmas and religious events. Time alone, sometimes in the very busy households and crowded households, was important, or just playing at home with their siblings. But most of their occupations were sedentary in nature and based at home and with online activities in addition to these outside of school. also wanted to share with you what the community leaders said about the young people. And as you can see there, and the first quote from Nikau, we've got a lot of champions out there, those aspirations. Oh, I want to be, I want to do. You fellas can do stuff, be who and whatever you want. They just need that nurturing, the support. All of them have got something in there. It's about drawing them out, about building their confidence. And from Trevor, some of our kids are awesome leaders within their community and their school. They can make real positive change. So these community leaders spoke to the innate abilities and skills that these young people had. And the key thing was about providing the support, the awhi, and the encouragement and nurturing that they required to reach their full potential. However, the environment, if you like, and the neighbourhoods weren't without their problems and challenges. As we hear again from Nikau, an important community leader, a big challenge is the environment, how it looks. It's gloomy, dark, and not good. Resources haven't been invested in the area. We're just used to that, having nothing. Yeah, and we're just sick of being where we're at because our people deserve more and better. I also looked at a range of documents to help triangulate the evidence I was collecting. And it's an example here from a police data available publicly, but looked at schools, sports and other occupational-based data. But you can see here that violent assaults and crime rates were quite a bit higher, 4 to 5 times higher than in more affluent areas in the 2 neighbourhoods that I looked at. A series of assertions that I worked on in the study that came out directly from the findings. So the first one here talks to children's agency, their ability to have some influence over their occupational participation. Just to read the quote from Miriama, who's 11 years of age. She says, every day I put my alarm at 7 o'clock and I go at 7:15. I just bring my bag and like do my hair, wash my face, and that's it, and brush my teeth. Yeah, and then I just head to school, say bye to Dad. So she's a young, sort of quite mature, but capable young woman. And just the things that she could do every day in her daily activities to get ready for school and help out at home really were important to supporting her father, Hemi, as a solo parent at home with another older daughter. But this is just an example of how these young people were contributing to their households, helping with caregiving, helping their siblings, supporting emotionally their parents as well as focusing on their education and their schooling. And just to follow up on that, and the second assertion, young people were often involved in household responsibilities or taking on caregiving roles. And another way that I sort of triangulated my findings was to look at based on my observations, both in the home and the community with the young people in their whānau. And this one is about Offa when I visited in the morning. I'll just briefly read that out. I visited Offa's home around 7:30 a.m. Offa, aged 12, was busy making school lunches for his younger siblings, boiled and smashed eggs with mayonnaise and white bread. Then Offa ducked away to wake his brothers and sisters. After this, he went about getting himself ready for school. He said to me when I asked, I've been up since 5:30 a.m. and had had my breakfast and then started to get the lunches ready. As you can see from this example, and it happened for a few of the other young people, they were really stepping up and doing their best to contribute around the household. However, this did concern some of the parents, and there is a potential for this to draw away from their other important childhood occupations, such as play and recreations and schooling. There is a bit of emerging data in New Zealand that's highlighting some of the effects, both positive and not so positive, for young people in stepping up into these caregiving roles in their home for a bunch of reasons. But the New Zealand government, however, was well behind on its duty of care for these young people and creating legislation to help them, protect them in this space. My third assertion is that both whānau, family and community were integral and important in enabling occupational participation. And they were doing things that weren't being met by other agencies in the community, or the extended whānau were helping in a number of ways when parents couldn't because of work commitments and busy time away from the home. Just want to highlight the example here from Tui, which was Jared's mother. she seemed to me like the street social worker or someone in the neighborhood. But she says, yeah, 7 are mine. The rest are fungi children. Keeps them off the street. And if they're not happy at home, gives them somewhere they can be who they are. It's a safe home. You can only heal hurt with a bit of love, eh? Because we're big on that in this house. And Tui had, I think about 12 children at any one time, and some of them were hers, and a number of them weren't. And there was young people, rangatahi, who had gotten in trouble, left their home, all sorts of things happening. And she just welcomed them in and realized that that was a need in the community that wasn't being met. The other important thing that we discovered, and it was a bit surprising somewhat to me, I think of supervisors, was that, well, clearly whānau and organisations serving the community knew what the needs were for these young people, but often they lacked the sustainable resources, or that there was changes in government policy that took away the resourcing or made it inequitable. Just hearing from Sue, who was one of the community workers, what she said was, we need to be addressing the issues like transport, finance, all that stuff for our children to be engaged in after school stuff. But nobody's interested in funding a piddly little community group trying to address the needs of their community. What Sue was really pointing out was, over the history that she's worked with this church-based community centre, funding has come and gone, even when they've had successful after-school programs that met the needs of the young people and continuing education that met the needs of parents. Government funding was pulled out, and that happened in quite a few examples. Also, Molly, the intermediate school principal, was pointing out that if they wanted to meet truancy issues, they really need to go back to the partnership they had with police, Oranga Tamariki, and also to bring in health hubs into schools. That's been written about literature elsewhere. A couple of key things in terms of, I suppose, a bit more of a deficit focus, but really highlighted that poverty constrains a choice and range of occupational opportunities for children, both directly and indirectly. You know, the lack of income and resources was obvious, such as a lack of transport that hampered their participation in sports or attendance at school, especially in bad weather. Indirectly, we can look at the risks in the neighbourhood, the lack of safety and the few opportunities that were afforded to the Tamariki outside of their home, as well as factors such as parents having to work long hours, shift work, and being a sole parent at home and having busy, large households, that all were features and factors impacting on what they could do for their children and what was on offer. Or sometimes it was the parents' health issues and not always having access to health interventions. This often led to a narrow range of activities and where they could access those activities. They were mainly immediately around their homes and their immediate neighbourhood. Just a point to this quote here from Maria Matteo's mother. Yeah, it will definitely be financial for sports. Fees were expensive, time, and transport. Got enough petrol to get there. So time is definitely a big one. Trying to work, and my availability as well. In Maria's case, she was raising a household of 3 Tamariki by herself. Her husband had left her. She'd come off the benefit, gone into paid work, which she'd got an opportunity, but she's also trying to complete study and trying to make a better situation of her life. But man, that was a busy life for her. Poverty also disrupts and negatively influences the habits and routines and roles and family rituals for the young people. And that was also evident. Here we can see that example from Tui, Jared's mother again. Now summer's here, it will be more outdoor recreation all the way, camping with kids, traveling. So yeah, we used to do a lot of that with our kids, teach them how to hunt and gather. But shit, this year, I think they will just be spending it at home. And also in the quote from Hemi, it points to the limited, narrowed occupations at home that were mainly online and sedentary. Online activity was often not monitored very much. So we saw that sedentary predominance of occupations in the focus groups and the online activity at home. And we also saw that in the individual interviews with the children and their whānau. We also saw the individual level disruptions to sleep routines, dental hygiene, school attendance in one case, and absence of homework primarily. And this was due to the restricted choices available to them. And for whānau and family routines, there were disruptions to evening and breakfast meals due to parents' busy work schedules, restricted spaces in the home, and opportunities such as going for walks with the family, family holidays, or other culturally relevant occupations. And finally, in terms of findings, what we asserted was that the disruption to their patterns and their participations of occupations would be depriving them of their full capacity to participate in future valued occupations, putting them more at risk of this, and it wouldn't be supporting their haora in the long term. I just point, for example, to Mattio's interview where he says, in terms of the context of not being able to go out of the home, his mum was really worried about the safety in the neighbourhood. If it's raining or after dark, then I can't go to the shop, can't walk down there or stay at the skate park to play basketball. Just chill out there, go for a walk with like one of my best mates. I don't never walk with my mates. And you can see some of the other examples there as well. What we concluded was that this was putting the young people's development, their health, their well-being, and the future outcomes at risk if nothing was done to help them. So to conclude the findings, what I believe is needed is that we need to continue to tackle the child poverty issue to reduce poverty or eliminate it if we can, and to provide the awhio support these young people need to realise their dreams. As you can see there, I want to be a basketball star. I want to graduate school, have a job, be a plumber, make my family proud. So definitely these young people had all the aspirations that you would expect. Briefly, the limitations of the study. There was only 2 cases. It didn't capture a rural context. It didn't capture the perspectives of those with disabilities. And finally, to touch on the broad brush solutions. So I know I'm running out a bit of time, so what is required is a public health approach that addresses these young people's occupational needs, but currently the policy doesn't approach the topic or the matter with a focus on patterns of occupation and participation. We need a transdisciplinary approach that's not just health practitioners, but community members and others as well. It needs to be informed by the voices and the views of those in the community and the young people. We need more local and central government sustained funding. And from that three-tier public health approach, I'm proposing that there's the government policy level that we need to work at, also targeted interventions at the groups at the local level, excuse me, and an individualized approach as a 3rd tier. So you can see some examples there. Just touch on a few as I'm running out of time. And that first, a broader tier 1 government and policy level, there could be interdisciplinary hubs at schools that involve occupational therapists as well as nurses and physios and others support the needs of young people. We need to eliminate policy that eliminates barriers to participation out of school, that ensures safety in university designed neighbourhoods and facilities. That's clearly not the case in the neighbourhoods I visited. At the 2nd level, we can design programs or groups or consultation that meets the needs of these young people in their participation. And obviously there is individual-based transdisciplinary approaches that address specific young people's health and disability needs. Thank you.
That was amazing. Thank you so much. I'll leave your slide up there if you can, Simon, because you're right. We have come to the end of our very short 30 minutes lunch and learn, and you've provided such a lot of food for thought with your research, and people will know that have been coming to lunch and learn for a while. The purpose of the lunch and learn is that as a group, we listen to people share their learnings or present from someone from a different workplace. And then the following month we have we ask people to come and meet again together so that we can discuss some of the learnings that we've found from Simon's presentation. And he's posed some three questions to us to sort of guide us in our thinking. So the first question is, in what ways does poverty influence Tamariki's participation in occupations within our clinical context or community? And maybe what is one strategy or intervention that you think could be implemented to support their participation in occupations of those children who are faced with poverty in our context? And what would the barriers and enablers be to improving their participation in occupations within our clinical context? Those are some three really meaty thoughts for us to ponder. I've seen that some people have joined us from Teams, and those will be really good conversations for you to take away over the month to come back. Donna and I will think about whether we're going to split us up into little breakout rooms or if we discuss it all as one big group. But I know myself, working in a child development team of children with disability, I was thinking of all your topics that you talked about, all the issues that there are for people, for children, sole parent, long hours of work, transport, safety. And it was really making me think about equity of access to the service that I provide. And, we're currently doing some work about prioritization of referrals. And there is this conversation of how do we address equity so that we can actually provide better care to children to try and, we're tier 3, we can't necessarily actively eliminate poverty, but we can maybe not add to the barriers that exist for children and Tamariki and their whānau who live with poverty by the systems that we perhaps unfortunately sustain. So I think as a group, we've got quite a lot to go away and think about within our clinical context. So I am aware that we've hit we've hit 12:30. I hope that people are excited about coming back, and I'm sorry that we can't really carry on.
I was going to say, if anyone's got any questions, feel free to put them in the chat and we can take a screenshot, or we can copy them and have them when Simon comes back in a month as well.
Yes, and also there's the this feedback thing here on this last one that tells you the date for coming back, and also a link there where you can join our mailing list and give some feedback on there. Perhaps I should have asked people to put questions in the chat as we went along. So you don't, just because the session's finished, you don't have to drop off now. If you do want to put some questions in there, that will help Simon and ourselves lead the conversation in the next month. But Simon, I just want to say thank you very much on behalf of the Paediatric Society for joining us today.
Thank you. And I can stay around for a bit longer if anyone wanted to ask me some questions. Yep. Thank you very much.
That's great.
Thanks for the invite. Appreciate it.
Thank you.
Kia ora.
Yes, so feel free to put questions in the chat if you have. Oh, great. Mark